Hello, my name is Michelle Herberts, and I am a pulmonary and critical care fellow, and I'm here today to talk to you about obstructive sleep apnea. During this talk, we will be discussing the definition, epidemiology, and symptoms of sleep apnea. We will also be briefly discussing the risk factors and treatments for sleep apnea. This talk will not include other sleep-related disorders such as central sleep apnea or obesity hypoventilation syndrome. The definition of obstructive sleep apnea is collapse of the upper airways during sleep that leads to apnea, hypopneas, or respiratory effort-related arousals. You don't need to know exactly what these are. I just wanted to make you aware in case you've ever had a visit with a provider for sleep apnea. An apnea is a cessation of airflow for at least 10 seconds. A hypopnea is a partial reduction in airflow that leads to a decrease in your oxygen saturation of at least 4%. And a respiratory effort-related arousal is any type of disruption of sleep secondary to a respiratory effort. So this is just a little picture here showing how our usual tissues are during normal breathing. These do tend to become more relaxed and floppy during sleep, and sometimes can lead to a partial obstruction of the airway or complete obstruction of the airway. When a partial obstruction occurs, you can have snoring and sometimes hypopneas. It's important to note that not all snoring leads to a hypopnea or an apnea. And then if you have a complete obstruction of the airway, that is when an apnea occurs. So sleep apnea is a very common problem. It's actually the most common sleep-related breathing disorder. It affects 15 to 30% of males and 10 to 15% of females. For reasons we're not exactly sure of, it is more prevalent in the African American populations, but it is increasing across all populations. Some studies have shown that the prevalence of sleep apnea has increased from 11 to 14% in adult males and from 4 to 5% in adult females in the past 20 years. There are quite a few risk factors for sleep apnea, the first being age. Every decade that your age increases, you have an increased risk for sleep apnea. This is usually until the seventh decade, then the risk plateaus, never goes back down to normal, however. We also know that people of male gender are at increased risk for sleep apnea. In fact, males are 2 to 3 times more likely to have sleep apnea than females. This is until females become postmenopausal, and then the risk appears similar. And this is due to the lack of estrogen, leading to more floppy upper airway tissue. Obesity also increases the risk of sleep apnea. One study has shown a 10% increase in weight was associated with a 6-fold increase in risk for sleep apnea. Anyone with upper airway or craniofacial abnormalities are at increased risk of having sleep apnea, and this includes enlarged tonsils, and this is the most common cause for children to have sleep apnea. Other less well-established risk factors for sleep apnea include smoking. Some studies have shown that smokers have an increased risk of having more severe sleep apnea. And one study did show that smokers were nearly 3 times more likely to have sleep apnea than past or never smokers. There has also been shown to be a link between people who have a family history of sleep apnea, but this is unknown if this is just due to increased risk of obesity and things like that among families. Other risk factors include nasal congestion. We're not exactly sure why, but people with nasal congestion have approximately a twofold increase in prevalence of sleep apnea when compared to those who do not have nasal congestion. There are a lot of different symptoms and features of sleep apnea. One of the most common symptoms we hear is presence of disruptive snoring. Although, as I mentioned previously, it should be noted that not all snoring is sleep apnea. You may also have witnessed apneas or times where you'll stop breathing, and that's noticed by your bed partner. This is usually followed by loud snorts or snoring as the patient starts breathing again. And people may also wake themselves up during these times. And that's called snorting arousals. People are also known to have excessive daytime sleepiness due to the fact that they are constantly waking up in the middle of the night and do not get very restful sleep. People who have a larger neck circumference, this is estimated to be a 17-inch neck in males and a 16-inch neck in females, are also at an increased risk of having sleep apnea. Untreated sleep apnea also increases your risk of having hard to treat high blood pressure. And people who have a more crowded upper airway are also at an increased risk of having sleep apnea. And this is, we characterize this by giving people a score or a Mallampati grade score, which if you hear someone talking about that is what we're referring to. So the Mallampati score, as you see here, is just kind of how crowded your mouth and the back of your throat is. And people who have a grade 3 or 4, as we see here in the right side of the screen, do have an increased risk of having sleep apnea, as the crowding of the mouth leads to increased risk of having blockage of airflow. Sleep apnea is usually diagnosed with a home sleep apnea testing. In people who have moderate to severe lung disease, any type of neuromuscular conditions or neuromuscular weakness, advanced heart failure, and recent stroke, a BMI over 50, or who have had prior home sleep apnea testing that has been negative or unsuccessful, usually have to come into the clinic for a sleep study. So home sleep apnea testing, you can see where the thing on your wrist and your finger, and sometimes you wear something else across your chest as well. They may be referred to as a watch pad or emboletta. Those are the brand names and the most common ones used. In your home sleep apnea test, the device that you wear monitors your heart rate, oxygen level, your body position, your chest motion, if snoring, if it's present, and the sleep that you're getting. It is a little bit less sensitive than an in-clinic sleep study for mild sleep apnea. And again, if you're not deemed a candidate for home sleep apnea testing, you may be asked to do an in-clinic sleep test. While you have an in-clinic sleep test, a sleep technologist will monitor your brain waves, your heart rate, your eye movements, your breathing pattern, your oxygen level, body position, chest and abdomen movement, limb movements, and snoring, or any other noises that you may make while you sleep. There is a benefit to an in-clinic sleep study, as if you're found to have sleep apnea, they can start you on a Cpap. at that time. And in real time, they will be able to see if that CPAP works for you. Sometimes if your sleep apnea is very severe, there's other machines that you may need to help control your sleep disordered breathing. And also, there are a lot of different masks that are used for the CPAP, and you can also try different CPAP masks out during the sleep study to see which one you're most comfortable with. Then based on the sleep testing, it'll be determined if you do or do not have sleep apnea and how severe it is. How we decide how severe it is how many times you stop breathing overnight per hour. So we use this by looking at the apnea hypopnea index score, and people who stop breathing or breathe a little too shallow will have an apnea hypopnea index score of 5 or 15 if you have mild sleep apnea. It would be a score of 15 to 30 if you have moderate sleep apnea. And then for people who have severe sleep apnea, it would be more than 30. Treatment of sleep apnea is very important because untreated sleep apnea can lead to increased risk of hard to control blood pressure. It will also increase your risk of stroke. People can also have issues with concentration and mood issues due to not getting restful sleep. People with diabetes can also have worsening glucose tolerance. People with untreated sleep apnea also have a higher risk of death from heart disease, increased risk of car accidents, and also have disturbed sleep of a bed partner if you have one. The last half of the talk, we will discuss the different treatment options for sleep apnea. This is not an all-inclusive treatment, but it is the most common. And these include CPAP, oral appliances, surgery, positional therapy, and behavioral changes. Behavioral changes are very important for patients that are diagnosed with sleep apnea, and weight loss and exercise is very important. And if you have mild sleep apnea, it can sometimes lead to resolution of the sleep apnea. Even a small amount of weight loss can decrease your severity of sleep apnea, such as a 10% overall weight loss. People will also be told to try to avoid alcohol and sedating medications because this increases depression on breathing, even if these medications are used during the day. So we will usually counsel people to avoid these if they're able to. CPAP is the gold standard treatment for sleep apnea that we have right now. It is a machine that can provide gentle pressure to your airways that will keep it open during the night. It's a machine that's attached to a hose and mask that goes over your mouth and nose, depending on the mask. And the CPAP will, again, gently blow air into your nose while you sleep and just puts just enough pressure on your airway to prevent it from closing. If the first mask that fits is uncomfortable, don't worry. There are many different kinds of masks, more than are pictured here. There are ones that go just over the nose, just under the nose, over both the nose and mouth, and over the mouth and under the nose. So there are a lot of different kinds and usually we're able to find one that's comfortable for people. Unfortunately, some people do not tolerate CPAP at first. Many people love CPAPs and sleep very well with them and feel very rested with them. But others do have issues such as feeling claustrophobic because you do have a mask over your face, feeling that there's too much pressure with the CPAP, having dry mouth or dry nose. Sometimes people also get nasal congestion or sometimes sores over the nose. If you do have any of these problems, don't stop using your CPAP, but would recommend that you reach out to your healthcare provider because there are many different ways to troubleshoot issues with the CPAP machine. And usually people are able to continue using their CPAP machine with these issues. The next treatment that I will discuss is an oral appliance. An oral appliance is usually not helpful for patients with severe sleep apnea. It is a device that is fit over your teeth, that is fit by a dentist. The lower jaw will be pushed forward with the device so that the airway is open while you sleep. The lower jaw is usually gradually advanced with the device to decrease your risk of jaw pain. People do need 8 upper and lower teeth to use the device. If you don't have the minimum number of teeth, then an oral appliance will not work for you. There are other tongue-related appliances that will move your tongue out of the way, but those are not used very frequently. For patients who are found to have sleep apnea that is most present on your back, which does occur fairly often, there are a lot of things that help you to not sleep on your back. This includes a fancy pillow that you see in the right upper hand that decreases the amount of back sleeping that you do. There is also a machine that vibrates when patients are on their back, and that is supposed to give people feedback to prevent them from back sleeping. There are even special t-shirts that you can put tennis balls in to prevent you from sleeping on your back. If you find one that works, it might be helpful, but I do hear a lot that it's often hard to use consistently each night. And some of the more advanced treatments are a little bit more costly. Surgery is another option for sleep apnea, but it's usually a last resort. I will only be talking about the hypoglossal nerve stimulation for surgery. There are upper airway reduction surgeries that are possible, but it really usually only benefits patients with tonsil enlargement and other upper airway abnormalities, which are not usually the majority of patients with sleep apnea. If you remember back to the previous picture, the blockage of airflow usually occurs below the upper airway. A tracheostomy is a tube that bypasses the upper airway and goes through the neck into the airway, and that is for patients with very, very severe sleep apnea and is a last resort and is very, very rarely used. So a hypoglossal nerve stimulation is a newer treatment that I'll discuss, and you may if a provider is to discuss this with you, they may refer to it as an Inspire device. And Inspire was originally approved in 2018 for the treatment of sleep apnea. And it's a device that is implanted and looks a lot like a pacemaker. It is usually given to people with at least moderate sleep apnea and who have failed a trial of Cpap. Patients also have to have a BMI of less than 32 as well and be over the age of 22. It is a device that stimulates the nerve called the hypoglossal nerve that controls the tongue and airway muscles. And this stimulation is to help the tongue and the upper airway muscles to remain open and out of the way of the airway, so that people will still be able to breathe at night. It does sometimes have to be reprogrammed to provide more stimulation to the nerve so that the airway will continue to remain clear. And sometimes sleep studies have to be repeated in order to see if the hypoglossal nerve stimulator is taking control of the patient's sleep apnea. It is fairly new. As I mentioned, it has only been approved in 2018. So long term, efficacy is currently unknown. I'm just briefly going to talk about this here, as many people that have been asking about it. You may have seen this on television. It is a new device that is designed for mild sleep apnea and is used during the day for 20 minutes a day. And the theory is that it would work the tongue muscles to prevent obstruction while sleeping. We don't have enough data to know if it's effective at this time. It's also very expensive, costing more than $700. And so again, it's just something you may be seeing on television, and we're really not sure how effective it is. Okay, so that was my brief overview of sleep apnea and the treatments of sleep apnea. And if you have any other questions, you can reach out to me in my email, herberts.michelle@mayo.edu. And there are my references. And thank you so much for listening to my talk.